work and insight you on herbal and alternative remedies used in the treatment of diabetes mellitus. Collaborative work between Rupesh K Gautam and Rajat Goel, Indore Institute of Pharmacy and MMM College of Pharmacy, Maharishi Markandeya University, deemed to be University Mulana Ambala. Yeah, today's agenda is abstract introduction. Diabetes and herbal remedies, anti-diabetic compounds from different plants, mode of action of herbal drug, marketed formulation, conclusion and references. This was the abstract we have shown in that diabetes is a major public health concern that has been progressively rising worldwide, and the various alternative medicine, herbal therapies are the means of using for the treatment of alternative source of the diabetes. This was the abstract. Now, the study also aims to identify the source of information and recommending the use of a particular herbal therapies, as well as justification explaining the underlying reason for its uses. Now, the introduction. All we know that diabetes is a chronic disorder of carbohydrate, fat, protein metabolism characterized by increased fasting and postprandial blood sugar level. It is a complex metabolic disorder resulting from either insulin insufficiency or insulin dysfunction. Various symptoms of diabetes mellitus are the high level of sugar in the blood, unusual thirst, frequent urination, extreme hunger and loss of weight, blurred vision, nausea and vomiting, extreme weakness and tiredness, irritability, mood change, etc. These are the various symptoms of diabetes mellitus. Now, classification of diabetes is two type insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. This is the difference between healthy and diabetic. In diabetes, it is not a single disease. This is the metabolic disorder characterized by hyperglycemia, glyciuria, and high level of glucose convert into the sorbitol, and it accumulate, and it increases the thickness of vessels and cellular proliferation. And vascular complications are there due to this accumulation, like atherosclerosis, retinopathy, neuropathy, and nephropathy. This is a difference between healthy and diabetes individuals. Like healthy, they release the insulin from pancreas and insulin receptor, and this is a glucose receptor, and entry of glucose can occur in the cell. But in type 1 diabetes, that insulin production is inhibited and glucose will accumulate or run in the blood and increase the glucose level. And type 2 diabetes, that insulin that it decrease the entry of the glucose inside the cell. This is the difference between type 1 and type 2. All know this is the general things. And diabetes and herbal remedies, medicinal plants have widely long history of usage, and today they are being widely used for various diseases. And several plants from different parts of the world have been investigated for anti-diabetic action. Various plants have been established for its anti-diabetic action. And before the discovery of insulin and hypoglycemic drugs, diabetes were treated with medicinal plants and traditional treatments. So far, the positive effects of over 1200 herbal drugs in reducing blood glucose level or the complications, various retinopathy or nephropathy, neuropathy due to hyperglycemia have been established. And medicinal and herbal remedies are effective and have less side effect. This is a herbal remedies have the very effective and have less side effect in comparison to the allopathic treatment and conventional treatment. And now various anti-diabetic compounds from different plants Like some plant family are there showing the hypoglycemic activity like Astaceae, Araliaceae, Cucurbitaceae, Laminaceae, Leguminaceae, Liliaceae, Moriaceae, etc. And the classification of anti-diabetic herbal drug on the basis of secondary metabolites are as follow. That like alkaloids, terpenoids, flavonoids, phenol, glycosides in alkaloids mainly uh, acetylene, berberine, mahanebine, and mycobinase in phenols, allicin, cardiac acid, pinol, trigonal, and glycoside, myricetin, 6-hydroxy, pyrazine, and triterpene. These are the 3-hydroxy, and then centellose, alpha-imarine, and flavonoids. These are the various alkaloid terpenoids, phenol, and flavonoids, glycosides are present in the plants, which are the responsible for the anti-diabetic activity of the herbal remedies. And next one is the yes. Now this is the mode of action of different herbal drugs, like plant drug acting like insulin, producing insulin mimic effect, as in Mermelos, Memoria, Chensia, Pterocarpus, Marsupium, Sarcopterium, uh, Cyanorum, and plant drugs increasing insulin secretion and release from beta cells like Allium cepa, Allium sativum, Aloe barbadensis, Citrullus, Ficus, Nigeria sativum. These are plants are using worldwide for the treatment of diabetes. Now, various plant drugs with possible actions of regeneration, repair of beta isolates of Langerhans, like Gymnema sylvestre, Pterocarpus marsupium, the plant drug which delay glucose absorption from GIT, that's Magnifera indica, plant drug showing alpha amylase or alpha glycosides, inhibitory effect like Azel, Marmelos, Carcinia indica, Ocimum centum, Tinospora cardifolia. These various plants have the mechanism in the for the decreasing the blood sugar level, that plant drugs modifying glucose utilization, Azadirachta indica, Gingiber officinalis. Uh, then these are the popular alternative remedies and treatment for diabetes, that food, that watermelon, black, we are using in your kitchen or daily life, that clove, coffee, flaxseed, garlic, ginger, guava, leaf greens, sweet potato, vinegar, and herbal supplements like aloe vera, American ginseng, bellberry leaves, manoroba seeds, cinnamon, curry leaves, drumstick leaves, fenugreek, neem oil, and other supplements like alpha lipoic acid, chromium, coenzyme Q10, magnesium, omega-3s, polyphenol, vanadium, vitamin C, vitamin D, calcium, and activities, acupuncture, this is, and yoga, spiritual healing, meditation, massage therapy. These are the various treatment alternative treatment method for the diabetes, and some marketed formulation also there, which used for the treatment of diabetes, like marketed formulation, Divicon DS, production of Himalaya, it stimulate production activity of, this is a very popular marketed formulation. Madhumar capsule, that control chronic diabetes mellitus, Herbal Hills Jambu, that Isha Agro developers reduce the level of urine and blood sugar, Diacare, that Edmark Herbal Limited stimulate production of insulin, Diabeta Plus, Planet Ayurveda stimulate production and activity of insulin, Stevia 33, that is stimulation of beta cells of pancreas, dia-fed, herbal feed, that maintenance of proper blood sugar level. There are many herbal marketed formulations are there, which are widely used for the herbal remedies for the treatment of diabetes mellitus, mostly for type 2. And these are the marketed formulation. These are the various figures of various formulation, Divicon, Madhukar, Stevia, Diafit, for of the various companies. Then the conclusion that currently more than 150 million people with diabetes across the globe, which seems to reach 300 million by 2025. And diabetes mellitus, most common disorder, currently affects more than 285 million people worldwide, and it is a large personal and economic burden of the nation. On diabetes, the WHO also recommended that medicinal herbs be further investigated, as they are commonly considered to be less toxic and have less side effect. And nature, all know that nature is the source of medicine plants, and worldwide various medicine plants available which are using to help the various treatment of the various diseases. The use of the herbal remedies is better because of the treatment is cheap and with the less side effect, and it is a request for advice to the agency like EDF, International Diabetic Federation, World Health Organization, etc., to implement the use of herbal remedies for the betterment of the society in terms of less economic burden and better health care. These are the reference which we have referred for this collaborative work, and thank you. Special thank to Rajat Goel, my co-investigator, and all the team member of this conference, Stelia Parker and other team members, for giving me this opportunity. Thank you so much.